My name is Ella Stockton, and I am a student occupational therapist at the University of Texas Medical Branch. And today I'm with Miss Maya Belot. Miss Maya Belot is going to be my patient today, and she recently got in a car accident and had a spinal cord injury occurring at her C5, C6 level. And so I'm going to be working with her a little bit. One thing about spinal cord injuries at the C5, C6 level is that they are able to actually have flexion of their elbows, and they're also able to have extension of the wrist. And one of the cool parts about the extension of the wrist is it allows you to have this tenodesis grasp that automatically kind of flexes the fingers. And so we're going to use that a little bit throughout our session today. So Maya, we are going to go ahead and get started. All right, so our goals for today's session is we are going to work with Miss Maya on going from supine up to seated, as well as donning and doffing pants. So we're going to start off with supine to seated. Maya has function of her biceps as well as wrist extension, but those triceps are not working right now, and so we're really during this going to want to maintain that shoulder external rotation, and that's going to really help us be able to utilize our biceps during those movements, as well as locking out that elbow. And so what we're going to do is I'm going to rock Maya back and forth, and then when she gets enough momentum, she's going to pop up onto one elbow. She's going to rock. She's going to pop up onto the other elbow, kind of keeping her shoulders externally rotated, locking them out. She's going to rock and then really externally rotating, locking out that elbow. She's going to be able to pop up onto that hand. And for patients, we also want to make sure that it's okay if they pop up onto their hand kind of like this, to maintain that tenodesis grip, because we just want to make sure that gets preserved during the process. And then what Maya's going to do is she's going to shimmy all the way up, locking out her elbows to where she is seated. So Maya, we're going to start that. I'm going to start by rocking you. We're going to go 1, 2, 3, pop, and then 1, 2, 3, and then continues. So we're going to start off with your left arm, and so we're going to rock 1, 2, 3, and pop. Great job. And 1, 2, 3, and pop. Great job, Maya. All right, we're going to pop up onto our hands, preserving that tenodesis, grip, 1, 2, 3, and pop. Great job, and rock, 1, 2, 3, and pop. All right, and Maya is externally rotated, arms locked out, and so she's gonna shimmy up, shimmy, shimmy, keeping that head tucked, arms locked. Great job, Maya. All right, so for our next goal, we're going to be donning and doffing pants. And so right now we're going to start off with the donning process. And so Maya's going to have her pants by her side. And for this one, we're really going to use that tenodesis grip, as well as our thumbs to anchor. And that's going to really help to kind of pull up as well as pull down. And so Maya's going to lift the opposite leg with the opposite arm, by hooking under, you got it, and then pulling up. And then kind of stabilizing with the other. Great job. And then we're going to grab onto our pants. And then Maya's going to put both hands in, and then kind of shimmy the pant leg, so that she can kind of just slide it into her foot. Got it? Okay. And she's also going to kind of use her forearms to help kind of lift that foot so that she can slide it in. Great job, Maya. So, we're going to pull. All right. And then Maya's also going to proceed by doing this with the opposite leg. So opposite arm to opposite foot, hook, and pull up. Great job. Both hands are going to go into that pant leg. And also again, shimmying that down. slide it under that foot. Great job. And all the way up. All right, and so we're going to kind of use that thumb grip tenodesis or putting both hands kind of in the pants. And now is when we're going to start by rocking. And as we rock, we're just going to kind of shimmy and pulling it up. Okay, so rocking to the side, to side, to side. And here, since it gets a little trickier, you can also put your hand then inside the pant to be able to pull it. But rocking, 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 rocking. And then another alternative, if you have maybe looser pants too, is being able to kind of grab the waistband and then you can just pull it up. Okay, awesome job, Maya. Next portion of our goal, it's going to be doffing pants. And so again, we're gonna kind of use that tenodesis grip. What we're really gonna do is we're gonna use that hook thumb to be able to kind of hold our waistband. We're gonna rock back and forth, kind of shimming that down, pulling. And whenever we get to kind of about the knees, Maya is going to hook under with her arm, and then with that thumb hooking, and she's gonna slide that leg out of that pant hole. So we're gonna start off putting your hand on the side, hooking. And if you need to go on your elbows, you can do that too. Great job. Okay, and then rocking back and forth. Just kind of slowly pulling it down. You got it. Rock, rock, rock. Okay, and she's at the knees, and so we're going to take our right arm and we're going to put it under our left leg. Hooking and stabilize, and so then we're going to slide it up. Great job. All right, and then we can do that with the other leg. Hook and slide it out. Great job. Using that thumb. And last one. Sliding out. Great job, Maya. All right, so we're gonna go ahead and wrap up our session for today. We were able to work on donning and doffing our pants with Miss Maya, as well as going from supine to seated. Some of the key things I think we were able to take away is that tenodesis, grasp, as well as that using that thumb as a hook. We were able to kind of target using body mechanics of shifting back and forth, as well as using that arm to hook under that leg to kind of navigate where we wanted that leg to be able to go. And so I think Maya did an awesome job with it. I think that one of the things in consideration for our next session would be balance, being able to work with her a little bit more on trunk control, because overall I think seating is going to be a challenge, especially at that that C5, C6 level. And so being able to work with her on that and some balance would be a really awesome kind of direction to be able to take this in. And so I think if this patient had a non-weight bearing upper extremity due to a shoulder fracture, I think there are a couple of ways that you could go about modifications for this. And so I would start off by just targeting some one-handed approach that we could kind of incorporate into her session. And so whether that's really going into that tenodesis grip, kind of figuring out how we can use that more, continuing to use that hook grasp, and a lot of just one-handed strategies. I think we can add in some wedges, which would be really great for shifting her body so that she can just pull those pants up. You can use wedges for a lot of different things. And then on top of that, I think adding in some rails, some bars, considering that she doesn't have that other arm to be able to work with. And so just some additional support. And then last but not least, just some caregiver training as well as training for the patient. And just how the caregiver can best assist her and just provide her with a safe approach for all these activities. So overall, I think it was a great session, and thank you all for joining us.